What if a simple fruit on your kitchen counter could help your prostate feel younger? And what if you could start today without pills, procedures, or confusion? I'm Dr. Rosalia Viterbo, and I help men navigate prostate health with science and kindness. If nighttime bathroom trips, weak flow, or worry are stealing your sleep, you're not alone. Enlarged prostate is common as we age, but suffering in silence doesn't have to be your story. Here's the surprising truth most people never hear during a clinic visit. A specific fruit, eaten the right way, can support a calmer, less irritated prostate. Not magic, just nutrients your body already recognizes, supported by careful research and years of practice. Today, I'll show you the fruit, the serving size, and the timing that matters. You'll learn how it may ease pressure, support urine flow, and help you sleep better. You'll also learn who should be cautious and how to combine it with your medications safely. Because confidence, energy, and the quiet moments you share with those you love still matter. Take a slow breath. This will be simple, respectful, and realistic. Bring a glass of water, sit comfortably, and let's talk about your prostate with clarity. In a few minutes, you'll have a step you can start tonight and feel hopeful. No gimmicks, no scare tactics, and no judgment. Just evidence and one fruit you can find anywhere. If you're ready to learn what actually helps an enlarged prostate feel less crowded, let's begin. Let's set the stage, because prostate symptoms are more than bathroom trips. They reshape your life. As the prostate slowly enlarges with age, it hugs the urethra and makes the bladder work harder. That means frequent urges, weak flow, dribbling, and nighttime awakenings that chip away at rest and patience. Poor sleep raises fatigue, mood swings, blood pressure, and even fall risk during dark, hurried hallway walks. It strains relationships too, because intimacy changes when you are uncomfortable, distracted, or worried about leakage. Confidence often fades, and energy follows, until hobbies shrink to fit around the nearest bathroom. Many men fear cancer, yet most of these symptoms come from benign enlargement, not malignant change. Still, symptoms can overlap, so regular checkups, a physical exam, and blood tests keep you safe. Common triggers hide in plain sight: late coffee, tea, alcohol, spicy dinners, and salty snacks that dehydrate. Decongestants can tighten the urinary channel. Some antihistamines hinder emptying. Diuretics push urine faster. Constipation worsens everything. Long sitting, stress, and pelvic floor tension add pressure, while excess belly fat fuels inflammation and urgency. Under the hood, hormones like DHT, oxidative stress, and reduced blood flow nudge the prostate toward swelling. That's the biology, but here's the hope. Small, steady choices can calm that environment and support balance. How would your life change if nights were quiet again and mornings started clear, steady, and unhurried? Wouldn't it feel good to trust your bladder on a long drive or a movie? The next step is learning one accessible fruit and a simple plan that respects your routine. We will pair it with timing, hydration, movement, and smarter evenings, so improvements feel natural, not forced. This isn't quick fix thinking. It's practical medicine, shaped by evidence and compassion for your everyday health. You are not broken, your body is signaling, and together we will respond with calm, consistent steps today. Before we start, remember that severe pain, fever, or blood in urine deserve urgent medical evaluation right away. For persistent symptoms, schedule a checkup. Teamwork with your clinician keeps progress safe, personalized, and sustainable over time. First, let's name the fruit and use it the right way. Tomatoes are a fruit, and they are rich in lycopene, a protective carotenoid that concentrates in prostate tissue and helps calm oxidative stress and irritation. That won't replace medication, but it supports a friendlier environment for easier urination. Cooked tomato products make lycopene more available to your body than raw slices. Think tomato paste, slow-simmered sauce, or a simple tomato soup made with olive oil. Aim for a small daily serving, about 1/4 to 1/2 cup of cooked tomatoes, and remember 2 tablespoons of tomato paste stirred into beans or eggs also works. Add a drizzle of olive oil because fat improves absorption. Keep the recipe simple with herbs and garlic, and go easy on salt. If acidity bothers you, choose low-acid varieties, blend with carrots, or split the serving. If you prefer fresh, use ripe tomatoes with a little olive oil, but remember, cooked still wins for lycopene. Watermelon, guava, and pink grapefruit also carry lycopene, though grapefruit can interact with medications. If you take statins or certain blood pressure medications, skip grapefruit and stick with tomatoes. Not everyone responds the same, so start small, be consistent, and track how you feel. Review weekly. Second, time it right and manage fluids wisely. Most men with urgency sleep better when they front-load hydration earlier in the day and drink consistently from morning through afternoon, then taper after dinner, try to finish larger drinks 2 to 3 hours before bedtime, limit caffeine and alcohol after mid-afternoon because both stimulate the bladder, and keep a water bottle nearby to prevent dehydration, which also irritates the bladder lining. Pair your tomato serving with lunch or an early dinner, not a late snack, and add fiber from vegetables or beans to steady blood sugar and support regular bowel movements. Constipation crowds the bladder and makes symptoms feel worse, while a calm, regular gut gives your pelvis room to relax. Third, support the pelvic floor and the bladder's rhythm. It sounds simple, but gentle breathing can reduce pressure in the pelvic area. Place a hand on your belly and breathe slowly through the nose. Let the abdomen rise on the inhale and soften on the exhale, and do 5 slow breaths before you urinate and again before bed. If you tend to strain at the toilet, pause and breathe instead of pushing, then try double voiding. After you finish, wait 30 seconds, relax, and try again. Aim for 10 to 15 minutes of easy walking after meals, because movement opens the hips, reduces stiffness, and improves circulation to the pelvis. Keep the lower abdomen warm at night if cold temperatures trigger urgency, and avoid long stretches of sitting. Stand up every hour and stretch the hips and back forth. Align this plan with your prescriptions and conditions. Do not stop medications without speaking with your clinician. And remember, alpha blockers can cause lightheadedness when you stand quickly. Rise slowly, steady yourself, and hydrate earlier in the day. If you use decongestants for a cold, know they can tighten the urine channel, and consider saline sprays or non-sedating options that spare the outlet. If reflux is an issue, smaller tomato servings with meals are usually easier. With a kidney stone history, rotate lycopene sources and keep hydration steady to reduce crystallization risk. Warfarin users should keep vitamin K intake steady, but tomatoes are modest in vitamin K, and the key is consistency, not perfection, plus honest conversations with your care team. Finally, track progress and set kind expectations. Tomato-rich meals help many men feel steadier, but change takes repetition. So give the plan 4 to 8 weeks because tissues respond gradually. Use a simple weekly checklist to notice trends, not perfection. Count nighttime awakenings, urgency episodes, and how often you feel fully empty, and note bowel regularity, evening fluid timing, and your average steps. If things worsen, contact your clinician sooner and review medications and triggers. If you see gentle gains, keep going and protect the routine. Remember that relief rarely comes from one action alone. It comes from small choices that add up: fruit, timing, movement, and calmer evenings. If you're sexually active, know that better sleep and less worry can lift desire and confidence, and that emotional lift matters for you and the person you love. If pain, fever, blood in urine, or sudden inability to pass urine appear, seek urgent care. Otherwise, stay steady, eat your tomatoes, walk daily, breathe slowly, and give your body time. You are not broken. Your body communicates, and you are learning the language. Tomatoes are a practical tool, not a miracle, and they fit easily into real life. Keep them on your grocery list, keep olive oil in the kitchen, and keep hope in view. I'll guide you through the next steps so your nights grow quieter and your days feel lighter. Let's bring everything together so your next steps feel clear and doable today. Your prostate symptoms are common, and they respond to consistent routines. You are not broken, your body is signaling, and you are learning to listen. First, remember the fruit. Tomatoes are a fruit rich in lycopene that concentrates in prostate tissue and calms oxidative stress. Cooked tomatoes work best, and a little olive oil boosts absorption. Use sauce, paste, or soup. Keep recipes simple and keep salt modest. Start with a small serving, stay steady, and notice how your body responds. Second, timing matters. Front-load hydration through afternoon, then taper after dinner to protect sleep. Finish drinks 2 to 3 hours before bed. Avoid late caffeine and alcohol. Pair your tomato serving with lunch or early dinner so evenings stay quieter. Add vegetables, beans, and whole grains for fiber. Constipation crowds the bladder and worsens urgency. Third, relax pressure in the pelvis. Use belly breathing before urinating and at bedtime to reduce tension. Avoid straining at the toilet. Pause, breathe, and try double voiding for a better empty walk 10 to 15 minutes after meals to open hips and improve circulation. Stand and stretch hourly, and keep the abdomen warm if cold triggers urgency. Fourth, fit this with your medications and conditions. Do not stop prescriptions without talking with your clinician, and rise slowly with alpha blockers. Decongestants can tighten the outlet. Prefer saline sprays or non-sedating options. If reflux bothers you, use smaller portions with meals and avoid spicy, late dinners. Kidney stone history needs hydration and rotating lycopene sources like watermelon or guava. Grapefruit can interact with statins and blood pressure drugs, so stick with tomatoes instead. Warfarin users should keep vitamin K intake consistent. Tomatoes are modest, and consistency is key. Finally, track progress with patience and honesty. Give the plan 4 to 8 weeks. Tissues adapt gradually, not overnight. Use weekly checklist items: awakenings, urgency, flow, bowel regularity, and evening fluids. If symptoms worsen, check in and review triggers and medications together. Seek urgent care for pain, fever, blood, or inability to pass urine. Otherwise, keep going, take notes, and protect what's working. You deserve steady sleep, calm mornings, and confidence with the people you love. Small choices add up. The right fruit, smart timing, relaxed muscles, safe medications, and tracking. Always listen to your body and let compassion guide your progress. If today's video helped you understand your prostate a little better, give yourself credit. Awareness is the first step to real change, and your body already appreciates your attention. Remember, small habits build strong results. 1 serving of tomato, 1 mindful breath, 1 earlier glass of water. These quiet steps protect confidence, energy, and comfort in your daily life. If you found this explanation helpful, consider subscribing to the channel. Here, you'll find calm, evidence-based guidance from a doctor who believes health should feel understandable. Each week, we explore topics like hormones, aging, and everyday nutrition in a simple, respectful way. You'll learn what truly works. No gimmicks, just medicine made human. Leave a comment if you've tried adding tomatoes or lycopene-rich foods to your meals. Share your experience. Your insight could help someone else sleep better tonight. And if you have questions about your specific condition, bring them to your next doctor visit. Partnership keeps you safe. Thank you for spending time here with me. Take care of your health, be patient with your body, and stay kind to yourself. I'm Dr. Rosalia Viterbo. See you next time.